and welcome to our webinar, Pathways to Financial Health and Resilience During COVID-19. My name is Al Moyato. I'm with National Disability Institute, and I'm going to go through a few slides here at the top before our presentation begins, just to make sure everyone can access audio and participate in the webinar. Listening to the webinar. The audio for today's meeting can be accessed using computer audio or by calling in by phone. If you select computer audio, please make sure your speakers are turned on or headphones are plugged in. If you do not have sound capabilities on your computer, or if you prefer to listen by phone, you can dial in to 1-929-205-6099. The meeting code is 870-6490-2468. Captioning. Real-time captioning is provided during this webinar. The captions can be found by clicking on the CC button in your Zoom controls at the bottom of the screen. If you do not see captions after clicking on the button, you can alert us via the chat box, and you can also view captions in your browser. And the address to do that is at streamtext.net/player?event=NDI. Submitting questions. Please use the Q&A box to submit any questions you have during the webinar, and we will direct them accordingly. If your question is not answered during the webinar, or if you're listening by phone and not logged in, you can email any questions you might have to Katie Metz, and her email address is kmetz@ndi-inc.org. Technical assistance. If you experience any technical difficulties during the webinar, you can use the chat box to send me a message, and you can also email me directly. My email address is amilioto@ndi-inc.org. Please note, the webinar is being recorded and materials will be placed on the following websites: the Financial Resilience Center, and that address is financialresilienceCenter.org/webinars, and National Disability Institute's website, and that address is nationaldisabilityinstitute.org/webinars/pathways-to-financial-health-COVID-19-webinar. And with that, I will turn things over to Michael Morris.
Oh, you're muted.
Yep, we can hear you now, Michael.
Does that work?
Yes.
Okay. Thanks, everyone, for joining with us. I'm pleased to be serving as the moderator today. Several months ago, we were very fortunate to be in discussion with Wells Fargo and talking about
keeping people housed in October.
Feedback. Is that clear now, Al?
Yes.
Okay.
Go ahead.
We were in conversations with Wells Fargo, and we were at the beginning of the pandemic challenges that was certainly had started in other parts of the world and had come to the United States. We are already beginning to see signs of just tremendous adverse consequences in terms of health and financial challenges to people with disabilities and others with chronic health conditions. And we were able to receive funding from Wells Fargo Foundation, which allows us to be with you and thousands of other people across the country, providing needed information about the changing picture of government benefits, about pathways to financial stability and resilience. And we had an opportunity with Wells Fargo to be joined by two other partners AFCPE, and LifeSense. You'll be hearing from all of our collaborators here today. If you can go to the next slide, please. I want to introduce first to you Bonnie Wallace, who is with the Wells Fargo Foundation Financial Health Philanthropy. If it wasn't for that beginning conversation several months ago with Bonnie, we wouldn't all be together today. It was an immediate response from Wells Fargo to the challenges that were beginning already to take hold back in March, affecting all of us across the country. And so you'll be hearing about this collaboration on this set of presentations today. But first, let me introduce Bonnie to you, and Bonnie will share some introductory comments.
Thank you, Michael. Can you hear me okay?
Yes.
Wonderful. So as Michael said, I'm with the Wells Fargo Foundation, and my specific area of focus is in financial health philanthropy. And I am very, very pleased to be part of this webinar. And you know, as we continue to deal with the effects of the COVID-19 pandemic and seeing it spread, you know, across the U.S. Kind of in a continuous fashion, you know, it's become increasingly clear that people with disabilities and chronic health conditions are particularly vulnerable to its effects, both health and economic. And we know that people with disabilities are facing greater economic uncertainty. Much like others, we're struggling to pay rent, mortgages, to keep up with monthly bills, and keep small businesses open. And at the same time, members of this community need to be able to access much needed services, and this is becoming all the more challenging during the phased shutdowns and quarantines. Yet really, in the midst of all of this uncertainty and growing challenges, there are people like Michael and organizations that are aggressively and urgently working to meet these ever-expanding needs. And then these organizations, what we're seeing from a philanthropy perspective is that they're really doing a great job of leveraging their strengths and their experiences and their networks to create and deliver innovative solutions. The National Disability Institute is one of those organizations. And as Michael said, at the earliest signs of the pandemic, Michael and his team anticipated that the need to have a single place, a single source for information regarding the pandemic and associated programs and services needed to be available to people with disabilities and chronic health conditions. And so they used their experience, they used their relationships to design the Financial Resilience Center. And this has just turned out to be an invaluable resource that provides practical and timely and trusted information, as well as access to both digital and person-to-person financial counseling. So I'm just thrilled to be able to represent the Wells Fargo Foundation today and provide our strong support of the effort and applaud the strong partnership between the National Disability Institute, the Association for Financial Counseling and Planning Education, and LifeSense, that together, they've collaborated and created and delivered a comprehensive financial health support set of programs and services to the community of people with disabilities. And so I'm thrilled to be here and eager to see what NDI has to share.
Thank you, Bonnie. And with that, can we go to the next slide, please? So I want to introduce you to National Disability Institute. Many of you online may be familiar with us, but some may not. National Disability Institute was created some 15 years ago with a very unique focus and lens. Many of us personally, either as individuals with disabilities or have family members with disabilities or friends, or we know someone in the workplace, we know people with disabilities have to overcome many challenges. But prior to COVID-19, people with disabilities really were beginning to see real gains related to participation in higher education. More people than ever before were in the workplace across market sectors. We were really beginning to see gains. And that's what National Disability Institute is all about. We were started to drive social impact, to build a better economic future for people with disabilities and their families through pioneering research, advocacy, policy development, public education, and innovative demonstration projects. Next slide, please. I want to frame up for the speakers who will follow me a little bit about the history of this collaboration going back to really February and early March. Understanding the challenges people with disabilities face in a COVID-19 environment. Next slide, please. First, to get a sense of the big picture, 30,000-foot picture, there are somewhere between 40 and 57 million people in this country with one or more disabilities. That disability may relate to hearing or vision, it may relate to mobility, it may relate to intellectual challenges, cognitive challenges. It's a diverse group of people. It represents some 13 to 20% of the population, and about 26% of households in this country have a child or an adult with disability. Now, if you take this number and combine it with people who have chronic health conditions that may not necessarily qualify to a level of a disability, but still has challenges to it in terms of it may relate to working, it may relate to moving around, it may relate just to general quality of life experience. The number in this country of people with one or more chronic health conditions, on top of this number of people with disabilities, numbers over 100 million people. That represents about 1 in 3 people in this country, a significant number of people, and probably everyone on this call knows someone with a disability, whether it's a child or a working age adult or someone older, as well as someone also challenged or separately challenged by a chronic health condition. Next slide, please. So National Disability Institute has spent much of its time over the past 15 years not only trying to educate people in government, educating and working with financial institutions, all types of community nonprofit organizations, to try to create pathways for advancing greater financial stability and security for people with disabilities. One of the things that we have most recently really focused on, and we started this work pre-COVID, was trying to understand more about the extra costs of living with a disability. And we have coming out for the first time, I believe in September, a new study that was done between NDI researchers and researchers at 2 universities that actually documents for the first time in a very empirical way the extra costs of living with a disability, whether that's costs related to healthcare, whether that's costs related to transportation, technology needs, just so many different variables that bring extra costs to someone to live a quality of life experience. And what these researchers have put together from their studies is a really fairly shocking number, that 28% more income, or over $17,000, almost $18,000 a year in extra income above median household income is actually necessary to obtain the same standard of living as a comparable household without a member with a disability. That's a pretty significant number. Next slide, please. So putting this in perspective with the coronavirus financial and health challenges, going way back then to March, National Disability Institute brought together about 18 national disability organizations early on in this crisis when it's just beginning, so many months ago. And we wanted to convene, a collective discussion on what are the challenges people already were having. And this is going back to March. Already, people with disabilities were losing jobs. Parents were losing jobs who were now at home with children with disabilities who already were beginning to no longer be able to go to school. And what we learned was that over the months from March to June, 20% of all working age adults with disabilities lost their jobs. 1 in 5. That compares to approximately 14% of working age adults without disabilities. But this next number is even more shocking. 43% of Black individuals with disabilities that were employed and at work in January were not at work by April 2020, almost 1 in 2. And the major reason for that is so many of the jobs this group of individuals had were really at the bottom of the economic ladder. They were in the hospitality industry. They were in the restaurant industry. They were not white collar jobs. They were blue collar jobs. And so very high unemployment. We also already saw challenges of access to healthcare due to the coronavirus, ongoing issues around beginning to stop long-term services and supports for people with disabilities that depended on them every day. So a lot of changes were taking place. Next slide, please. Another slide, I think, that puts a context on the discussion that will follow me is we also have been doing and looking at more numbers. And this has to do with the net worth of households framed by different individual demographics or individual characteristics. So these are statistics actually that existed pre-COVID. Households' average wealth without a disabled working age individual was approximately $83,000, almost $84,000. Across all groups, regardless of race, gender, other factors, the average wealth of households with a disabled working age individual shrinks from $84,000 to $14,100. But this last data point is even more shocking. Black households, average wealth, where there was a disabled working age adult, the average wealth was only $1,282. And so it's in that context that the coronavirus set of challenges hit everyone, but it hits some people from these statistics you can see harder than others. Next slide, please. And this one further slide is again about this divergence of really income security, stability, and level of economic status by really looking at a comparison of people with disabilities versus people without disabilities. So people with disabilities who are white are almost approximately four times more likely to be living at or below the poverty level than people who are white without disabilities. People who are Black and disabled, about twice as likely to live below the poverty line. Latinx, 15 versus 28%, and indigenous populations, 20 versus 34%. So again, some significant differences, and this was pre-COVID. The biggest factor here is not enough participation in the workforce. And as a result, limited income, which again pushes someone at or below the poverty level. Next slide, please. So it's within this context, sharing with you some data points, all of us still experiencing the impact of COVID, We were so fortunate, as I made the comment in my opening remarks, to bring together an unusual collection of organizations driven by the philanthropic support of Wells Fargo Foundation. The hub of this effort to build a path to financial stability and resilience for people with disabilities and others with chronic health conditions nationwide was the establishment of the Financial Resilience Center, an unbelievable website with a comprehensive set of information. And our director of that website, Katie Metz, will tell you more about it. Katie?
Wonderful. Thank you, Michael. You hear me okay?
Yeah.
Great. So thanks again, Michael. Thank you again to the Wells Fargo Foundation. We've worked with them for many years. They're our longtime funder and partner. So I always like to give them thanks for the opportunity that we could truly address the needs and concerns of individuals with disabilities and chronic health conditions and their families. And as Michael said, we really try to make that kind of differentiation, make sure that we are encompassing chronic health conditions, as many individuals with disabilities may not identify as a person with disabilities, but however, they are certainly very much affected in this pandemic. And so we want to always be inclusive of including individuals, you know, and as Michael said, we've worked for years towards advocating and helping individuals with disabilities and their families become more financially resilient to build a better economic future for themselves. And as Michael illustrated with the numbers he gave us, we know how difficult that often can be and the many barriers people with disabilities encounter. So when COVID-19 hit, we knew what a devastating impact and setback this would create for the individuals that we serve. And, you know, between the listening sessions, our many years of working in the field, and then the online survey where individuals responded, it really gave us a great deal of insight on the immediate concerns of this population during the current crisis. The conversations and the information that we gathered just reaffirmed for us that people with disabilities would definitely be, as Michael said, one of the hardest hit by the health, social, and certainly the economic impact of the virus. So we knew we had to do something more. We needed to provide individuals and their families with a go-to trusted resource so they could find answers to their questions related to the pandemic. And we knew we had to do so in a format and language that was clear and easy to understand. So we wanted to keep talking about financial education and providing that and information directly to individuals, while also promoting effective financial decision-making and stability in these kind of adverse and uncertain times. And so we did create the Financial Resilience Center. Next slide, Al. And actually, you can go one more for me, please. So we launched the Financial Resilience Center. We were going to call it FRC for short, especially today, so I don't trip over my own words there. But the FRC was born with the goal of truly serving as the go-to and trusted resource on financial health and resiliency for people with disabilities and other chronic health conditions. There was a lot of information flowing, especially in the early stages of the pandemic, I'm sure as many of us remember. And it was a lot to take in and a lot to digest for all of us. But we wanted to also ensure that people with disabilities were specifically getting answers to their questions, both in general and specifically related to what might be their unique situations as a person with a disability or an individual accessing means-tested benefits. We wanted to ensure that they were able to access these answers in a format that was both accessible and easy to understand. And we also wanted to set the stage for individuals to begin and continue to work towards being more financially resilient, so that they would have direct access to financial education and informational opportunities while seeking answers during these uncertain times. We knew we wanted to answer questions in the now, but also to promote and help them make good financial decisions so we could help them build their financial stability so they can be prepared in any time of uncertainty. We do currently address COVID-19 and the factors around that, but we also want to ensure in the long-term strategic sense that we're just building the financial resiliency of people so they can deal with whatever life throws at them. Next slide. So with all this in mind, we began working with our team and our partners to build the Financial Resilience Center website. It's an online informational hub that helps people with disabilities and other chronic health conditions respond to the financial challenges currently of the COVID-19 pandemic. So we used the data and the feedback we had collected from our listening sessions, from the survey, and from our work in the field to determine the topics of interest that people with disabilities might be dealing with financially during the current pandemic. From the very beginning, we also recognized that an online informational hub would not necessarily be all that everyone needed, that there would be individuals that might need access to additional assistance and resources. And as Bonnie mentioned earlier, we really tried to make a kind of comprehensive response to what individuals might need and want during the crisis. So you'll hear more later about the additional assistance available to our partners with LifeSense and AFCPE in just a little bit. But with FRC, we really worked to address the frequently asked questions that we were hearing and address the community concerns as they arose. The site's constantly evolving and being updated with information and alerts as they become available. We provide analysis of federal policy and impact. Currently, there's an analysis of the CARES Act available, and we are committed to provide additional analysis as legislation is passed and as it becomes available. We also provide tips on how to be more financially resilient and encourage individuals to sign up via email for our newsletters, our updates, and our alerts as they also become available. Next slide, please. So as I mentioned previously, we use the information gathered prior to our launch to develop our topic areas of interest. And you'll see here, they're very similar to what any of us really have probably had questions and concerns around when it comes to COVID-19 or we're in a crisis or a panic. But we continue to evolve these. So we work on information around the economic impact payments, employment, unemployment, public benefits, managing money, housing, food, healthcare scams. All of the components have a financial piece to them, so we wanted to make sure we were addressing the needs of individuals, and specifically when it came to finances. And we continually evolve and add to this content based on the current information in the field, from our partners, from our users. We have an online survey that pops up, and we have a contact us page. So this allows individuals to give us feedback so we know if we're meeting the needs of our users, and they can provide us with any content that they would like to know more about, so we can add to the site constantly. We also have a page specifically for our deaf and hard of hearing community, which we're very proud of, because the deaf and hard of hearing page is all videos in American Sign Language. And so these videos allow deaf individuals, they're made by deaf individuals, to speak directly to other deaf and hard of hearing individuals for those that use ASL. And the videos are continuing to be developed and will be added ongoing. Next slide, please. So here's one of the latest updates to give you an example of how we really work to provide updates and information ongoing. It's estimated there are probably 9 to 12 million Americans who still need to take action to claim their economic impact payment. And so we work with our partners in the field. A number of our team members talk to our colleagues and national organizational partners. And we work with them to identify what are the resources that are out there. Here are just a few. United Way 211 has both a website, and they also have information available online. You can call or text them at 211 for your local 211 to get more information. But they've also established a national helpline, which really is just a testimony to how our partners, we work together to kind of fill those gaps. So that the individuals can call and talk to someone directly around how do they get more information on how to file their economic impact payment, how do I file my taxes, and if they call the helpline at 1-844-322-3639, they can actually talk to an individual who would, if necessary, walk them through filling out the online non-filer tool. There's also Get It Back campaign, the Get It Your Refund.org campaign, and of course our IRS partners that we have always worked with since the beginning of NDI. And all of those are great resources for individuals to be able to go on, get more information about how to claim their economic impact payment. Many individuals may think that I have to file taxes in order to do so, and that's not true, that they can actually use the non-filer form. And so we also had information that recently came out from IRS where they have extended the deadline for using the non-filer tool this year till October 15th. So individuals can still use that form to hopefully get their economic impact payment, which we know individuals need very much so right now in these times. And then I'll touch on briefly too, the IRS has also reopened the registration period. So we had sent out some alerts in early May. There was a very short window of time for federal beneficiaries who didn't receive the $500 dependent payment. They only had till a few days, about a week or so, to be able to fill out the filer form in order to get that additional $500 dependent payment if they hadn't gotten it already. And now individuals have until September 30th. They've reopened that registration period. So we want to make sure we get it out, spread the word, so that people get this money that they really do need to help to get them through during these times. Next slide, please. I just wanted to briefly recognize, because again, you'll hear from them a little more, our partners with License and AFCPE. They've been wonderful. We've worked from the beginning with both of them because again, we wanted to have a really comprehensive way to provide individuals and families and our partners, providers in the field, ways to help individuals. So they have the self-paced online financial wellness training through License, and the opportunity to get virtual financial counseling and coaching through AFCP. And again, you'll hear more from them coming up. Next slide, please. So what can you do? If you're listening today, please, we encourage you, visit the Financial Resilience Center, look at the information, the resources, and the tools that are available. You know, share them with your family and your friends, utilize those resources. If you see something that we missed, let us know. Email me. There's, again, a contact us page. You can reach us in a variety of ways and let us know, what else do we need to add? Does your organization have a resource that you want to share? Questions that need to be answered? Please let us know, and we'd be happy to, add that to the website. Use the outreach toolkit. You'll find that on our homepage, linked in the very top right corner on every page. We have great information our communications team has put together to help you, help us share this information. So you can refer to friends, family, people you serve. It includes a video that you can use. It includes a news briefing, emails. You can stick it into a newsletter or an email that you might be sharing. Social media information, logos, links. We encourage everyone, if you can, if you have a resource center, to please add our site to your resources so that people can find information, sign up for our updates and information. And then we do have an area where you can send us your financial resilience tips and stories. We're always looking for that kind of thing so that we can share with others best practices in the field. What are you doing to get through COVID-19, this pandemic? Share those with us so we can share them with others, and we can recognize you if you allow us to do so. Next slide, please. So finally, I'm going to provide you, there's my contact information, my email, my name, my title. Please reach out to me. I'm happy to take questions and give more information via email. And then there's our social media content as well, if you'd like to follow us and get updates as we provide them. With that, I'm going to turn it over to my colleague, Rachel, with AFCPE, so she can tell you about all the wonderful things that AFCPE is doing. We're very lucky to have them as a partner and have the opportunity to be able to refer individuals to them for that one-on-one. Rachel?
Thank you, Katie. Can everybody hear me okay?
Yes.
Okay,
Yep.
wonderful. Sorry about that. Well, as Katie said, NDI has created an incredibly robust financial resilience center that really is sort of that one-stop shop for finding resources and support during this time. And we're very fortunate to have some generous funding from the Wells Fargo Foundation to sort of take those resources and give individuals, people, and families who are living with disabilities the opportunity to meet one-on-one with counselors who can support them and navigate financial difficulties during this time. Next slide, please. Oh, that's sort of the same slide. Next slide, please. So before we get started into the financial counseling and coaching services that we're providing, I just wanted to give you a little background on who AFCPE is and who our professionals are. If you're not familiar with our organization, AFCPE stands for the Association for Financial Counseling and Planning Education. We are a national nonprofit that was founded over 35 years ago to support the field of personal finance and financial counseling and to set the highest standards for the profession. As an organization, we certify, connect, and support personal finance and social service professionals throughout the country and through the military, also throughout the world. Our vision as an organization, we believe that all people, regardless of income or background, should have the opportunity to achieve lasting financial well-being. So whether you're someone with wealth, or you're living in a low-income situation, we believe that all people deserve access to financial professionals and the opportunity to achieve financial stability. Next slide, please. To kind of break down what AFCPE does as an organization, we are a certifying body. So we certify financial counselors, coaches, and educators. Our most well-known certification is the AFC certification. That's the Accredited Financial Counselor. It's been around for more than 25 years. It's NCCA accredited, which means that we report to an outside accrediting body. All of our professionals have to achieve 1,000 hours of experience. They take a rigorous exam, sign a code of ethics, and go through ongoing continuing education. So when you meet with an AFC, you know that they have that holistic life cycle financial education, which really equips them to speak with someone and support someone with credit issues, debt issues, all the way to retirement and estate planning. And so that allows our professionals to really give an individualized service and not a one-size-fits-all prescriptive solution. We also offer membership. So we're a unique community that sort of connects the entire continuum of care in the personal finance profession. So we really integrate financial services from financial counseling, financial coaching, financial planning. We believe that everyone working together will allow more people to achieve financial equity and stability. And we also provide financial education for professionals. This image that you see on your screen right now, this just shows the diversity of what our professionals do. AFCPE certified professionals are not employed by AFCPE. For this program, they are volunteering their time to meet with individuals and families nationwide. In their day-to-day life, they work in a variety of capacities. They may work for a university, financial aid, the military, banks and credit unions. They might have their own private practice or work in a community-based organization. But their education is the same. Their background really brings a unique perspective to what they do. Next slide, please. So this gets me to what Katie was referring to. We are, thanks to Wells Fargo funding and also to our partner, the Yellow Ribbon Network, for providing the platform that these counseling sessions are happening on. We are offering free virtual financial counseling and coaching. As I said, this was actually created in response to the COVID-19 pandemic, but it's really open to everyone. You can, if you have specific questions that you need answered, you can reach out to a counselor, or if you just want to use this time to get your life back on track, there's someone there who's available to help you. Next slide, please. Up on the screen now, you'll see just a few of the ways that a financial counselor can support someone during this time. They can help a person manage immediate expenses and prepare for future emergencies. They can help you determine which bills to pay first and which payments can get deferred. One of the top questions a lot of people are reaching out to financial counselors for right now has to do with, a loss of income stream. So my hours have been cut at work, or I've been laid off, I can't pay my rent, a financial counselor can help work through that budget and help you navigate these difficult times. A counselor can also build a plan to help you pay off your debt, or creating strategies to avoid debt in the future, to navigate unemployment benefits, and help you allocate any government funding that you may have received through stimulus dollars. Next slide, please. One of the programs that our volunteer financial counselors have been through is called the Financial Inclusion Essentials Program. And this training was developed by NDI and delivered in partnership with AFCPE. And so all of our, almost, I would say about 80% of our volunteers have gone through Financial Inclusion Essentials training. And this training really equips them to better support people who are living with disabilities, who have family members with disabilities. And so they have specialized training and background to be able to provide better financial counseling during this time. I also want to call out, and I mentioned it a little bit before, but the AFC certification is really different in the sense that it isn't a one-size-fits-all curriculum. Our certification really helps our professionals better understand how diverse backgrounds, perspectives, and experiences impact a client's money behavior. And so they're able to combine their expertise and bring empathy and compassion to their meeting with clients. Next slide, please. So this, essentially what I said before, who can take advantage of this opportunity? Anyone can. You don't need to be wealthy to speak with a financial professional in this instance. If you want to meet with someone who's unbiased and qualified, just remember you don't have to navigate this alone. Next slide, please. If you're interested in meeting with a counselor, or you know someone who could benefit from meeting with a counselor, we strongly encourage you to share this link. It's yellowribbonnetwork.org/AFCPE COVID-19. When you get to this website, you'll be there'll be some information at the top, and then you'll be prompted to create a login where you'll answer a few questions. And then we have a client manager behind the scenes who will connect you directly with a counselor. This typically takes about 48 hours. We do our best to connect you to a counselor, typically in your regional area or time zone, or that best fits your needs and your requests through the intake form. Next slide, please. The program itself, to go a little, actually back slide, please. Sorry about that. One other thing I just wanted to note when you sign in, the Yellow Ribbon Network creates a platform that allows you to meet with your counselor directly within there. So you will, within 48 hours, you'll get either a phone call or an email from your counselor to set up an appointment at a time that works for you. How you're contacted is how you request to be contacted. Then the actual meetings will either happen over the phone or on a virtual platform such as Zoom. What the Yellow Ribbon Network platform provides is a HIPAA compliant place to share information with your counselor. And so you know it's safe and secure, which is really important when you're talking about your finances. Next slide, please. This is just some additional resources that AFCPE is offering during this time. There's the direct link to register to meet with a counselor. We've also offered several consumer-facing resources and webinars on our website. You'll find these at www.afcpe.org/COVID-19. Next slide, please. I encourage you to connect with AFCPE for more information on the screen here or our social media, where you can find us at AFCPE on Facebook, LinkedIn, Twitter, YouTube, Instagram, And I didn't put my email on the screen, but I will share that in the comments in the chat box so everybody has that. You're more than welcome to reach out to me directly if you have questions. I'm always happy to support. We encourage you to share this opportunity, whether it's something you can benefit through directly, or you can share with a community-based organization, friends, family, a place of worship. During this time, it's really important that we all have somebody we can lean on and a place to go to help us navigate our personal finances. Thank you. Andrew, I'll turn it over to you.
Alrighty, thank you very much. Hi everyone, my name is Andrew Adams and I work at LifeSense. So we can just dive in. What we'll be going through today is what LifeSense is, how it works within the partnership, and how you can access it. Next slide, please. Thanks. We can actually jump on to the next slide, please, as well. So LifeSense is an online financial tool. It's a secure platform, much in the same way that Yellow Ribbon is. What we focus on is on allowing you to really self-direct your own financial journey and building your own financial wellness. We do that through helping you acquire the knowledge, build better habits, and gain confidence around your finances. So really how we're designed is to help you better understand what's going on with your finances, really where you are, get a better picture of that, set goals, and really move along. And that way it's a lot like a personal trainer in that, it is a personalized journey for everyone going through it. And as you go through, it better understands you and can actually help make better recommendations. And since this is an online tool, you can access it anywhere, anytime. Next slide, please. So what we're going to go through today is really how LifeSense works. As I said before, it's an online personal tool, online financial wellness tool that really is personalized and helps you achieve the goals that you set forth. So next slide. So the way we start off is by really understanding your story by letting you tell it. It asks a series of questions and it actually simulates a conversation. So it feels very conversational, like you would actually have with a financial coach or advisor. And by asking the series of questions and providing your answers to them, we'll actually be able to help build a profile around your finances, your current situation, what you want to achieve, and then connect you to the right resources. Next slide, please. So based off of all of those inputs and the profile that you build, you'll actually receive a personalized wellness plan. So the core of the LifeSense experience is actually an interactive dashboard, which really takes where you currently are and gives you next steps, so you always know where you can go, or some next actions that you can take immediately to help achieve your goals, or also if there are areas that you want to improve upon your financial knowledge, habits, or so next slide, please. So, based off of your inputs, LifeSense makes recommended what we call connections. These are real-world solutions as well as tools that you can access directly from the platform. A great example of this is actually the AFCPE coaches. So based off of what you put in there, we'll actually recommend real-world solutions that can help you achieve your goals, and as well as education that can help you reconnect gaps in knowledge and achieve goals. Next slide, please. So a big part of the experience. I'm sorry, I just realized my audio is not doing well right now. Just adjusted it. Sorry about that. So a big part of the LifeSense experience is to really understand your progress, where you are currently, and help you take steps towards achieving your goals. So based off of that, we really break it down into different areas that we call topics. So we ask you basically, where do you want to focus on? What is important to you when it comes to financial wellness? And then based off of that, we take you down different pathways, different education, different resources, and other real world solutions. And it's curated, so it's always going to present to you relevant information, but also help you celebrate the milestones that you move forward through, as well as anything that you achieve along the way. We also break down financial health by 3 measures of financial health that you can very clearly take action toward improving. This is IQ, habits, and mindset. And these are denoted based on different activities that you can take within LifeSense, as well as different educational resources. Next slide, please. All right. So as you move through the program, or as as your situation changes over time, we want to make sure that it's what you're being shown and recommended in LifeSense actually changes with you and is reflective of your current situation to always stay relevant. So we capture that through a few different ways, by asking you questions as you go through to make sure that we have the most up-to-date relevant information, but also the information that shows up on your dashboard is always going to be based upon questions that you have answered, information that you've put in. And as we receive new information or your situation changes, we're actually going to go ahead and make new suggestions for you as we move through. And as you actually move through, your progress is always saved. So each time you log into LifeSense, you can start off from wherever you left off. So whether it's 15 minutes later, a week later, or even a year later, you'll always be able to pick up where you left off whenever you log back into LifeSense. Next slide, please. So really, in that way, your journey through LifeSense and your financial journey is set up to be really cyclical, and something that something you can constantly work on and improve over time. It starts off by you telling us your story and us getting an understanding of really what makes you, what makes you your financial situation unique, and then based off of that, we'll develop a personalized wellness plan, which we provide to you through your dashboard as really your homepage in the experience. From there, you can engage with the recommended resources and education in order to help improve your financial health and really improve the situation and reach your goals. Based off of that, we measure your progress and help you celebrate success through very clear measures of progress and success. And then we provide ongoing guidance in order to help you improve your financial situation. And then again, tell us your financial story. What's changed? What's improved? What still needs to be worked on? And based on that, update your plan. Next slide, please. So a couple quick things. One question we get all the time is, what does LifeSense cost? LifeSense is actually free to you to use through the Financial Resiliency Center, thanks to the generous support from Wells Fargo. And then also, like I said before, the information that you provide is in a secure location, very much like Yellow Ribbon. And anything that you provide to us will always stay private and confidential. It is never shared or used outside the platform, and is really only used in order to make recommendations for education, for tools, and for real-world resources that you can use to help achieve your financial goals. Next slide, please. So lastly, where to sign up. You can actually sign up through the NDI Financial Resiliency Center. If you just go to the page and scroll down, you'll see the LifeSense logo and a link to this program page you see here. You can also sign up directly at ndi.lifesense.com.
And if you go there, you can sign up, and it will take you right into an introductory process where we'll ask you a few basic questions where really all you need to provide to sign up is your name and your email address. Next slide, please. And with that, I believe we bring it back over to Michael.
Do that. There I am. Okay. Wow. I've been living with this for months. I remember when it was just conceptual. It was then an outline, and now it is alive and well, and thousands of people have visited the Resilience Center site. And what I'm excited about here today is hopefully with the people listening in, we'll realize that in addition to the thousands who have visited the Resilience Center site, there's these other opportunities of free and really no cost assistance with financial counselors and then with the LifeSense platform. Can we open it up and see? We may have some questions and see if we can take them. So let me put a few forward. Does AFCPE have materials to support volunteer financial education work? I work for AARP and I'm trying to coordinate some free outreach programs. So what's the answer to that?
This is Rachel. We do not have specific resources, but we have several partners who offer free resources. One in particular I recommend is the Consumer Financial Protection Bureau, and I can put a link in the chat section as well, but they have wonderful tools and resources that can be ordered for free for use in financial education.
Okay. Another question is, can we share what us on the intake form, can you share what us, probably with us on the intake form, so that we would know what our own clients might encounter?
Yeah.
Yes.
Sorry. This is Rachel again. Of course, so the intake form will ask for basic contact information, demographic information. It will ask if you have a disability or if you have a person in your home who is living with a disability. We also request contact information. So if you prefer to be contacted by phone or email and which time of day is best for you. So that way the counselor who reaches out knows the best time to get a hold of you. And then we require just an open-ended description of what you're looking for, whether that's credit or debt issues or, specifics around what you're navigating during this time. And this information, is all confidential for your counselor, but just really helps them, be prepared for that first meeting with you.
Okay. And this question is for LifeSense. Would you consider LifeSense appropriate for retirement and estate planning?
There. So as far as retirement and estate planning, we do have content and resources in LifeSense that deals directly with those issues. I would always recommend that this does not take the place of a certified financial advisor. So it's really meant to be there to supplement and help grow your own knowledge and education, so you can go into those conversations more prepared. But that there is certainly information within the platform that could definitely be helpful to help prepare you to those. And that'd be found through the resources section.
Okay. Watching the time, we're just about out of time. Maybe I'd love to do this at the end of these kinds of webinars. Just quickly go through. First, Katie, on behalf of the Resilience Center, what's a message you want to leave with the many people who have joined us today?
Well, I think first and foremost, thank you to everyone for their interest, for coming on, but also to just please share the information. There are so many people out there that we know aren't getting information about economic impact payments. They still need the money, unemployment. So please, please, please look at the information and share the information with others so that we can help as many people as possible. Thank you, Michael.
Okay. And similar question for AFCPE. What's the takeaway you want? What's the message to leave with those who've joined us?
Yeah, well, first of all, thank you again for letting us be here today and for everyone who took the time to join in. But I just want to echo Katie. You know, I think during this time, a lot of people don't know where to turn and what resources to trust. And the partners on this call have developed really fantastic resources to share with your communities. And just a reminder that there's no shame in reaching out to a financial counselor during this time. Even if you're not struggling, I think everyone can find benefit in speaking with a qualified financial professional, and it's safe, secure, and with someone who's trusted.
Great. And life sense, what's a message to leave people with?
Well, thank you very much. And, you know, one thing that we definitely want to leave people with and make sure they understand is the program is definitely built understanding that everyone's financial situation is different, and everyone needs access to different resources. And, you know, much like AFCPE's counselors and the Financial Resiliency Center itself, we definitely want to make sure that you are always having access to the most relevant resources. And if there's anything you ever need from us, we do try and make that as automated a process as possible, so everything you see is always relevant. But if there's anything you ever need from us, we are always here to help. You can always reach out to support@lifesense.com.
Great. And really, to close us up, as we're just at the hour, Bonnie, on behalf of Wells Fargo Foundation and philanthropic efforts, a closing message. Did we lose Bonnie, or is she muted? Okay.
Well, still have it, but
we don't have it. Okay, no problem. Let's just conclude by visit the Financial Resilience Center website. It gets you the link to AFCPE and LifeSense. Look at these additional resources. There's a lot there that can help you. We know so many people are challenged. The extra federal supplement of unemployment insurance has stopped. It may continue again. You'll learn about it as soon as we know what's happening on the Financial Resilience Center site. Similarly, if there are going to be additional financial support of other benefits, there may be another economic stimulus payment made to millions of American families. There may be additional support to community nonprofit providers, hospitals, healthcare workers. Congress right now has reached an impasse, but I do believe that impasse will be broken before the general election in November. The sooner the better. But right now, if you need support through the wonderful efforts of Wells Fargo, representing NDI, LifeSense, and AFCPE, try us out if you haven't. Learn more, share the information with others. The best path to resiliency is support. You're not in it alone, and we have lots of ways we can help you. So thank you to all the presenters, and thank you all for joining us. Today's webinar was, again, supported by the generous funding provided by the Wells Fargo Foundation. And please visit the Resilience Center. More new information will be coming as soon as we know about it in terms of additional government assistance. Thank you, and we hope we'll be talking with you and visiting with you again soon. Take care.